And erythron, as I said, is a bone marrow capacity. So if you look at a mature red blood cell which can survive in the circulation without a nucleus for 120 days, for our understanding, we can round it up to 100 days. So roughly 100 days is a survival. Then it makes sense to imagine that we are losing 1% every day, and we need to produce 1% every day. So the red cell destruction, if you take survival is 100 days, we lose 1% of cells every day. That is equal to 300 billion red cells. We have 5 million per cubic millimeter. Our whole blood contains 300 into 100 billion red cells. So every day we are making, that's an enormous number. We need to make 300 billion red cells to keep up with the daily losses. For an average man of 70 kg, if you say 70 ml per kg, we are looking at red cell mass of 30 ml per kg. So that is equivalent to 2.1 liter of red cells and 2.8 liter of plasma, which makes around 5 liters. 1% of our red cell mass is equal to 20 ml of red cells, 20 ml of pure red cells. And we need 1 milligram of iron to make 1 ml of red cells. So for example, if we need to make 20 ml of red cells per day, we need 20 milligram of iron to be supplied to the erythron. We need 20 milligram. Fortunately, 19 milligram of this iron comes from recycling within the reticuloendothelial system, and we need only 1 milligram from the external source, because 1 milligram is permanently lost, as I said, from the shedding of senescent cells of the gastrointestinal and genitourinary tract. This physiological need increases to 2 milligram per day in menstruating women, young women, and it is 3 milligram per day for a lady who is pregnant or lactating. So 1 milligram for all males per day, 2 milligram for females per day, and 3 milligram for pregnant and puerperium lady. Interestingly, even though the daily need is 1 milligram and daily capacity of production is daily need for production is 20 ml of red cells, when there is increased demand, we can increase this to 60 ml per day. So from 1% destruction up to 3% destruction, we can compensate. We can compensate by producing 3%. So when we need 3%, including the recyclable iron, we need 60 milligram of iron per day. Please note, if there is no iron store at all, then all the 60 milligram should come from the dietary source in the form of supplements or from the parental source. So when somebody is depleted of iron stores and they need to maximally produce 3%, 60 ml of red cells per day to completely correct the anemia in the next 1 month. Suppose, for example, if you treat them with pharmacological doses of iron, for example, 300 milligram of elemental iron, you will absorb 50 milligram of iron. So 50 milligram of iron will be able to make 50 ml of red cells. So to compensate and correct the anemia over the 4 weeks of iron therapy, you need to give 50 to 60 milligram of iron per day. So further looking at the iron homeostasis, the body stores are 50 milligram per kg, that equals to 3.5 gram in an adult man, of which 2/3 is the red cells, 10% is in the form of myoglobin and enzymes, and rest is in the reticuloendothelial system, liver and bone marrow, mostly in the form of ferritin, which is first method of storing in a protein molecule. When there is excess iron, more than that can be packed up in the form of ferritin, that spills over into the form of hemosiderin, which is a phosphate and other chelated molecules. So the second domain is absorption. We all know that diet should contain enough iron, mostly in the form of animal protein, which is heme, and some can be extracted from vegetable. And there should be an intact gastrointestinal tract, especially the stomach, with a good acid capacity to split the iron from the diet, and a healthy duodenum, because iron absorption happens mostly in the proximal duodenum, in the duodenocytes. So from the dietary iron of 15 to 20 milligram, we can absorb up to 1 to 2 milligram. That is more than enough for a physiological state in a male and most of the females. But in pregnancy, this may not be enough what dietary alone can supply. So dietary alone dietary iron is mostly heme in 10% only, but 90% comes in the ferric form, which is Fe3. But this ferric form should be reduced to ferrous form, which is Fe2, to be absorbed into the system. And the divalent metal transporter present in the duodenal site is the uptake site.